what exactly is occupational therapy?
Well, occupational therapy addresses a patient's functional independence in activities of daily living. That could range from as basic as getting yourself dressed and ready for the day to as advanced as managing your money, your medication, preparing a meal, or returning to a job that you've not been able to do due to a disease or an injury.
So it's a big deal. It's about living. And what conditions or diagnoses can be treated by occupational therapy?
Well, there's actually quite a range of ages that we see, anywhere from infants to geriatrics, and also a large range of diagnoses. They can be in the category of a neurological dysfunction, someone who's had a stroke, a brain injury, been diagnosed with a degenerative condition such as MS or Parkinson's. We would work also in the orthopedic category. If someone has had an injury, a fracture, a joint replacement to their upper body where they need to regain strength, range of motion, coordination, those hand-eye coordination skills. In pediatrics, we also look at a lot of deficits in the areas of what are those skills those kids need to be successful in school, their handwriting skills, their ability to use scissors, their ability to sit in a chair and pay attention.
Sure.
So yeah, it just kind of depends on the age of the patient and what condition that they're facing. But yeah, occupational therapy's main goal is to promote independent living in whatever phase of life they're in. And yeah.
So what does an evaluation for occupational therapy entail, especially since the age range is so different?
Yeah, in a nutshell, we take a comprehensive evaluation where we look at the patient's medical history, what's brought them to that point, and then we take a look at their strength in their upper body, their range of motion that they have, their coordination skills, their dexterity. Depending on the client and their condition, we go as in depth to look at their visual perceptual skills, which is more than just vision. It's what the eyes and the brain are communicating together. And then we also look at sensory processing, and that's especially for those little kiddos, you know, so many with autism and developmental delays. So we look at how their body takes in the sensory information and then how they react and process it. But once we do an evaluation, we basically have that important conversation with the patient and family and say, what are your goals? Your goals are our OT goals.
Sure.
We want to address exactly what they aren't able to do, what they want to be able to do, and that's about living. That's your occupation.
Sure. So how do I know if I or someone I know or love needs occupational therapy?
Well, if you look at them and they are struggling in some area to not be independent, then they could benefit from occupational therapy. For instance, you know, it might be grandma that, you know, is short of breath and needs some strategies on how to simplify her life, how to conserve her energy. Occupational therapy also specializes in adaptive equipment, so we have some nice tools that simplify life for people. But yeah, basically you look at, is there someone in my life struggling to be independent and to be functional in their life, and they could benefit from OT. It's definitely worth an evaluation.
And then if I do feel like someone in my life, or maybe myself personally, could benefit from those services, how do I go about obtaining occupational therapy?
Yeah, what you would do is first have that conversation with your physician, discuss your concerns, your deficits with your doctor, and then if he or she deems it necessary and appropriate, they would give a prescription for an occupational therapy evaluation and treatment. After you obtain that, you can contact any of our offices and schedule an OT evaluation.
So I can get those services right here at IPT?
Yes, that is correct.
And you guys have 10 locations, so you make it easy.
We try to. I am primarily at the Stellhorn location, but in special circumstances, I would be able to visit those other locations as well.
So if you or someone you love is in need of occupational therapy, check them out right here at the Stellhorn location at IPT. Anyone who may be struggling can really benefit from these services, so be sure you give them a call today, and we will be right back on Insight.